PTSD is a mental health condition that can occur after experiencing or witnessing a traumatic event, such as military combat, sexual assault, physical violence, or a natural disaster. It is estimated that around 7 to 8% of the U.S. population will experience PTSD at some point in their lives, with higher rates among certain populations such as veterans, first responders, and survivors of interpersonal violence. The symptoms of PTSD can vary widely, but typically include re-experiencing the traumatic event through flashbacks, nightmares, or intrusive thoughts, avoiding reminders of the event, feeling on edge or easily startled, and experiencing negative changes in mood or cognition. These symptoms can be severe and long-lasting, and can have a significant impact on a person's ability to function in daily life. One of the key features of PTSD is that it involves a reliving of the traumatic event, often in the form of intrusive memories or flashbacks. This can be particularly distressing, as the person may feel as though they are experiencing the trauma all over again, with all of the associated emotions and physical sensations. In some cases, people with PTSD may avoid situations or activities that remind them of the trauma, in an attempt to prevent these distressing re-experiences. Another common symptom of PTSD is hypervigilance, or a state of constant alertness and readiness for danger. This can manifest as difficulty sleeping, irritability, and an exaggerated startle response. People with PTSD may feel as though they are always on edge, and may struggle to relax or feel safe even in situations that are objectively not dangerous. PTSD can also lead to significant changes in a person's mood and thought patterns. This can include feelings of guilt, shame, or despair, a loss of interest in activities they used to enjoy, and difficulty concentrating or making decisions. These symptoms can further impact a person's ability to function in daily life, and may lead to problems with work, relationships, and overall quality of life. While PTSD is most commonly associated with military combat and other forms of violence, it can also occur as a result of natural disasters, accidents, or medical procedures. Any event that is perceived as life-threatening or extremely distressing can potentially lead to PTSD, and the severity of the trauma does not necessarily correlate with the likelihood of developing the disorder. Diagnosing PTSD can be challenging, as the symptoms can overlap with those of other mental health conditions such as depression, anxiety, and substance abuse. However, there are established criteria for diagnosing PTSD, which include exposure to a traumatic event, re-experiencing symptoms, avoidance symptoms, and hyperarousal symptoms. A mental health professional can conduct a thorough assessment to determine if a person meets these criteria and is experiencing PTSD. Treatment for PTSD typically involves a combination of medication and therapy. Antidepressant and anti-anxiety medications can be helpful in managing symptoms such as depression, anxiety, and insomnia. Therapy approaches that have been shown to be effective for PTSD include cognitive behavioral therapy, CBT, exposure therapy, and eye movement desensitization and reprocessing, EMDR. These therapies can help a person process their trauma, learn coping skills to manage symptoms, and develop strategies for avoiding triggers and re-experiencing. While PTSD can be a difficult and debilitating condition, it is important to know that recovery is possible. With the right treatment and support, people with PTSD can learn to manage their symptoms and improve their quality of life. It is also important for loved ones and caregivers to understand the challenges of living with PTSD and provide support and empathy to those affected. One of the challenges of living with PTSD is the stigma that can be associated with mental health conditions. People with PTSD may feel ashamed or embarrassed to seek help, or may be reluctant to disclose their condition to others. This can lead to feelings of isolation and further exacerbate symptoms. It is important for society as a whole to recognize the impact of trauma on mental health and to reduce the stigma surrounding mental health conditions. Another important factor in recovery from PTSD is self-care. This can include practicing relaxation techniques such as deep breathing, meditation, or yoga, engaging in physical exercise, getting enough sleep, and eating a healthy diet. These practices can help to reduce stress and promote overall well-being, which can in turn help to manage PTSD symptoms. For those who are living with PTSD, it can be helpful to connect with others who have had similar experiences. Support groups, online forums, and peer counseling programs can provide a sense of community and understanding. These resources can also provide valuable information on coping strategies and treatment options. In conclusion, PTSD is a complex and challenging mental health condition that can have a significant impact on a person's life. While the symptoms of PTSD can be distressing and long-lasting, recovery is possible with the right treatment and support. It is important for society as a whole to recognize the impact of trauma on mental health and to reduce the stigma surrounding mental health conditions. By providing support and empathy to those affected by PTSD, we can help to improve the lives of individuals and communities. Thank you for watching. We hope that we have expanded your knowledge somewhat. It would be awesome if you would join us, comment, like and subscribe. See you next time. Have a great day.